For any surgical procedure, it's important to know that you're not just a patient, you're an active team member in this event. That means there are things you can and should do before surgery to benefit you and help shorten your recovery. Here are a few tips. Most patients have a few months to prepare for a surgery. Try using that time to return your body to its ideal weight.
Ask your family doctor or a dietitian about creating a weight loss plan just for you. Or you could join a well-known program in your community to help lose any extra pounds.
Focus on eating healthy foods to give your body the right amount of vitamins, minerals, and nutrients to promote healing and fight infection.
Try eating lots of fruits and vegetables, whole grains, legumes, fish, and red meat or dark meat chicken for its iron, which strengthens your blood.
Being fit can directly affect how fast you recover. Research shows that having a healthy heart and lungs make it easier to tolerate anesthesia during surgery and to heal afterwards. Being in good shape also improves your mood, helps you sleep better, and can even decrease pain after surgery. Regular physical activity is the key to so many health benefits. If you're already active, great, keep it up. And if not, maybe start with a morning walk around the block and then increase your exercise as your fitness level improves. If you have difficulty with arthritis or joint pain, try non-weight-bearing activities like swimming or cycling. If you have other conditions like heart problems or difficulty breathing, talk to your physician before starting a regular exercise program.
Please note, rapid weight loss 4 weeks before surgery is not advised. Acceptable weight loss is about 1 pound per week.
Some medical conditions like heart or lung disease, Parkinson's, or diabetes can increase your risk of complications after surgery. It's important that any medical condition is under control before your operation.
See your family doctor or medical specialist for a complete tune-up at least 6 weeks prior to surgery. You should also discuss any existing medical conditions at the hospital's pre-admission or optimization clinic prior to surgery.
Getting an infection before your surgery may cause your procedure to be postponed, because an infection can weaken your immune system and make your body less able to heal.
Avoid crowds and people with contagious infections 1 month before and 1 month after surgery. If you think you've picked up an infection, tell your doctor. Stay well nourished and get plenty of rest.
The importance of quitting smoking cannot be overemphasized. Smoking causes many chronic diseases. It also slows your healing after surgery, increases your risk of anesthetic-related problems, and could cause lung complications like pneumonia.
Stop smoking 2 to 3 months before your surgery. See your doctor if you've had difficulty quitting in the past.
People who drink alcohol on a regular basis may be at risk for alcohol withdrawal. This is a serious and potentially life-threatening condition. Alcohol may also interfere with anesthetic drugs and pain medication.
Have no more than 1 standard drink per day beginning 1 month before your operation. 1 standard drink is 12 ounces of beer, 4 ounces of wine, or 1.5 ounces of hard alcohol.
Now that you know how to prepare your body for surgery, there's another important thing to prepare: your home. Remember, your ability to move normally and keep your balance may take hours or even days to return to normal after surgery. So you may need to make a few small changes to create a safe, convenient place to recover.
Clear floors of clutter and loose carpets. Consider rearranging your living space. For example, moving your sleeping area to a main floor. Ensure that you have adequate lighting, especially in halls and stairways. Inexpensive night lights can be a simple, effective solution. Secure railings in stairways. Rearrange regularly used kitchen items so they're easy to reach. Consider using a cart for transporting food and other items in the kitchen. And consider contacting your local community health department to arrange for a home safety consultation.
Before you enter the hospital, it's critical that you identify a responsible adult who can help care for you after your surgery. Here are some things this person will need to do to keep you safe and comfortable.
Arrange for a person to drive you home from the hospital. Please be aware that public transportation or taxis are not acceptable alternatives. Depending on your surgery, you will need a support person in your home for the first 24 hours after your operation, or possibly longer. Ask your doctor or hospital's pre-admission clinic what's right for you.
If either a ride home from the hospital or a support person cannot be arranged, contact your hospital's pre-admission or optimization clinic before your surgery.
Now that you're up to date on how to prepare your body and your home for your upcoming operation, there are a few last details to keep in mind.
If you take prescription drugs, the pre-admission clinic or your physician will tell you which medications to continue on your day of surgery and which ones to stop. On the day of your surgery, bring all your medications with you to the hospital. Your nurse will review them upon admission. Also, make sure your prescriptions are up to date and that you have enough medication on hand once you return home. Before your operation, your surgeon or the pre-admission clinic will give you fasting instructions. For your safety, it is important to follow these instructions. Usually, you will be told not to eat or drink anything after midnight on the day of your surgery.
If you are a diabetic on medication, you will be given instructions on how to adjust your medications the day of your surgery. You will still be required to fast, but your healthcare team will frequently monitor your blood sugar levels and maintain them in a safe range.
Herbal and naturopathic remedies like ginseng, garlic, ginkgo biloba, and others can cause problems during and after your surgery. While most vitamin supplements are safe, vitamin E may increase bleeding. It is best to stop taking any of these types of remedies at least 10 days before your surgery. Finally, please make sure that you leave valuables at home on your day of surgery. Your care card and other identification should be left with your support person before you are taken to the operating room.